Good morning. So this morning we're doing some Botox on Andrea, my lovely model here. So a question we get asked a lot is how many units do I need? So we'll kind of talk about how many units per area. So right here in the brow area, we often call it the 11s because when you squeeze your brows together, you see these 11s pop up. So a common dosage in this area is around 15 to 25 units. So Andrea isn't moving very much when you see her squeeze her brows together, so here I'll probably dose her with about 15 units. Then another common area is in the forehead here, so when she raises her brows you see these horizontal forehead lines, so we'll dose her pretty well up here just to kind of, because she's pretty much even across with the forehead wrinkles. So we'll probably dose her, a normal dose is around 10 to 15 units, sometimes more. Again, depending on how much you have there and how frozen you want it to appear. Some people still like to have some movement, but Andrea likes to be pretty smooth and frozen. And then the other area that we're gonna treat is right in the crow's feet here, is what we call them. So these little radiating lines that come from the corner of the laugh lines. So we'll probably dose her pretty well here. She's got pretty much a full fan, meaning it's goes all the way through here. We also dose a little bit in the tail of the brow with usually about 2.5 units to just lift the lateral part of the brow, just to kind of open up the lateral part of the eye and just to smooth this here. And she likes to try and get rid of these under eye wrinkles, so we'll dose her probably anywhere from usually 7.5 to around 15 units. So we'll dose her pretty well here, about 15 units on the side for the crow's feet. So I start off just by cleansing the skin here. And then I usually ask her to squeeze your brows together. So we'll dose right here in the corrugator or the procerus muscle here. And then squeeze again and relax. Right in the tail of the corrugators there. So these little kind of mosquito bites that you see here, those will go away within the next hour. The little red bumps that look like mosquito bites. So then I'm going to cleanse the forehead here. And the lateral brow. And I'll ask you to lift your brows up so you can see the muscle moves perpendicular to the wrinkles. So her wrinkles go across this way, so her muscle is pulling in this direction, which is perpendicular to the line that I see. So I usually come up really high up here in the hairline and dose with just 2 units. And raise up again and relax. And raise up. Raise up again and relax. And relax. Raise up one more time and relax. And one more time and relax. So now I'm going to go right at the tail of the brow here in the orbicularis muscle. That's going to give that lift to the lateral brow. And then right here, we're going to dose about 5 units. Again, that's going to relax those crow's feet. And then just 2.5 here. So as far as aftercare, no exercise for 24 hours. Again, a little bit in the tail of the brow here. She needs to keep her head elevated for the next 4 hours. She doesn't have to rub the areas. You don't have to move your face around. No tight fitting hat or headband. It usually takes about 2 weeks for it to settle in. It's not uncommon to have a little bit of unevenness as it's starting to kind of take effect. But usually by 2 weeks it's settled out completely. It lasts usually about three months on average. So we dosed Andrea in total about 50 units.